Hi, my name is Dr. Richard Winter, and I am the president and owner of Hampton Dental Associates. Our website is hamptondentalassociates.com, and I hope people will go there to become more educated about dentistry. The thing that I specialize in, I happen to be a diplomat in the American Board of Oral Implantologists. There's only about 550 of those in the country right now, and I'm a fellow in the American Academy of Implant Dentistry, and I'm also a diplomat in the International Congress of Oral Implantologists. So my focus has been on how do we rebuild smiles, and that's led me on that journey. So after 30 years of dentistry, I'm hoping to educate my patients that while dentures seem like a really good idea, they're really just a hockey puck of teeth, and nobody wants to live in these for the rest of their lives. So I always try and convince people that we need to be able to upgrade away from dentures. Wearing dentures can cause a lot of sores. It can cause digestive problems because, as you see, they're not connected to the brain, so we can't chew as hard. In addition to that, some of the damage that dentures do is they create a tremendous amount of bone loss. When you start off with all of your teeth, you have a tremendous amount of bone. After 5 years of wearing dentures, you can see just how much bone has been destroyed from that denture moving around. And after 20 years, instead of biting with 250 pounds per square inch, which is enough to bite a raw carrot, you're at 25 pounds per square inch, which is basically an overcooked mush carrot. So my job is to prevent this from happening. How do we prevent jaw bone loss so that we can wear dentures or have comfortable chewing throughout our lives? We can place dental implants. A dental implant is a titanium cylinder, and that titanium cylinder gets put into the jawbone to help stimulate that jawbone so the jawbone doesn't go away. So whenever somebody says to me, you know, I'm not thrilled with my dentures, one of the first things we're going to try and do is preserve what's left of the bone by placing dental implants, or even a mini dental implant, because mini dental implants, while they're very, very small, they can certainly be used to stabilize a denture. Where a mini implant fails, though, is that a mini implant is much, much smaller in diameter than a regular implant, and mini implants can't support bridge work. So what I do with my patients is we talk to them about how can we reverse engineer their treatment. How can we find out where their comfort is financially, emotionally, and then maybe what we're going to do is start with 2 implants. 2 implants and a denture is still going to give people a lot of stability and a support so that that denture just doesn't come out. They don't need to live with putting in tubes of denture adhesive. They don't have to have all that goop in their mouth, and they can have some dignity. What can we do if we want to do something even better than snap-on dentures, and that's snap-on dentures? We can have 2 snaps, we can have 6 snaps, we can have many more. We can make screw-retained dentures. Dentures that go into the mouth that you simply can't take out. And many of the things on my website talk about zirconia bridges or porcelain bridges on implants. So one of the things that I lecture about is called Upgradable Dentistry, where we help people to have whatever level of dentistry that's comfortable for them, personally, financially, emotionally. And while that might start with some minimal implants, we can always go to more implants and do full mouth reconstruction. When you look at my patient Harry here, for example, we put in many implants. We preserved all of the bone in both arches. And as you can see here, we've given him a lot more light in his eyes, a lot more joy in his smile. And that's my goal at Hampton Dental Associates. How can I help you regain your youth, regain your ability to chew and talk and eat with confidence, and not feel like you're embarrassed and have to talk with your hand over your mouth? The last thing that I'll mention is that it's very important that if you do need to have any teeth removed, that you talk to your dentist about bone preservation. Because once the bone is gone and we're dealing with a very, very difficult situation, the talk about implants becomes a lot harder because now we have to rebuild the bone. So I think it's very important to talk very early in your denture experience with your dentist or with me about how do we preserve the bone so that we can have dental implants for a lifetime and hopefully avoid the more costly and expensive bone grafting that will occur if we don't put anything in at the time your teeth are removed. So again, I want to invite everybody to come to my website at hamptondentalassociates.com. Please check out all the different photos and videos. Please look at and like all the social media that you can click on and get to from my site, and be as educated as you can about your dental decisions. The more we can help our patients be our team member when it comes to diagnosis, treatment planning, the happier everybody's going to be, because an educated patient is going to be a happy patient. And if you like food and you want to check me out on my food blog, please make sure you come to @Milwaukee Food King. Have a great day, and I hope to meet all of you soon.